half of all the people found, 653,000 people, half of all of them were found in only 4 states. And 24% of that total were in New York City or Los Angeles. And so this prompts a series of questions we want to ask today. How do you create a consistent, coherent national policy around homelessness when it is such a disparate set of conditions out there in the world in which we're working? And I'm delighted to say that we have the 3 best people in the United States to answer these questions this morning. To my left, we have the CEO of the National Healthcare for the Homeless Council, and my illustrious predecessor at Care for the Homeless, Bobby Watts. We've also been joined by Jeff Olivet, who is the Executive Director of the U.S. Interagency Council on Homelessness. And Steve Burrow, who is the Chief Policy Officer at the National Alliance to End Homelessness. I'd like to start by asking each of you if you would give us a couple of sentences on what your organization does, just so that the audience is completely oriented. Bobby, could we start with you?
Yeah, certainly. And thank you, George, for that really gracious introduction. And he called me his illustrious predecessor. I often say, I told our staff I've been at Care for Homeless more than 22 years. And when I was leaving, they said, oh, no one can replace you. I said, yes. Not only am I replaceable, I am upgradable. And George has proven me right. I'm thrilled to be here representing the National Healthcare for the Homeless Council, which supports the 300 federally qualified healthcare for the homeless programs. There are 300 across the country. There are 13 here in New York City, and also the 170 or so medical respite programs, of which now New York has some, which I'm thrilled about. So in short, what the council does is we facilitate peer learning. We bring our communities together to learn from each other, to learn what works, and just as importantly, what doesn't work, so we can shorten the learning curve. We are committed to systemic solutions, so that means we have to be involved in advocacy. And that's been part of our DNA from the very beginning, just as it's been part of the Care for the Homelessness DNA, in part because of our founder, Susan Nybacher, who was really interested in policy, and she was also one of the founders of the National Healthcare for the Homeless Council.
Thank you, Bob. Jeff, what does the Interagency Council do?
First of all, George, I just want to say thank you for the invitation to be here. I've been involved with Care for the Homeless for almost 20 years, back to when Bobby Watts was executive director. I grew up in the healthcare for the homeless movement as a street outreach worker and a case manager, and I just love the work that Care for the Homeless does. And this topic today around national and local, I think you said it very well, is the right conversation to be having right now. The U.S. Interagency Council on Homelessness is the only federal agency with the sole mission of preventing homelessness. And what that means is we serve as kind of the point person, the point agency on federal homelessness policy. We bring together the work of 19 other federal agencies, just get your arms around that, 19 other federal agencies, and try to get them pointed the same direction. And that's HUD, Health and Human Services, the VA, Department of Agriculture, Education, Labor, and many others. And one of the main vehicles we use for doing that is a federal strategic plan. And you may be familiar with our plan that we put out a couple of years ago called All In. And the point of that plan is to create a national policy. Now, the challenge, and I'm sure we'll get to this in a few minutes, is that elections have consequences. And with the new administration coming in, federal policy will change. What my hope is that much of what we've laid out in our strategic plan and in our work over the last 4 years is a direction that states and localities and local nonprofit and philanthropy can carry forward, even in the face of what I think could be some harmful federal policy changes. I don't want to start too dark, but I guess
We're going to get there eventually anyway. So. Thank you, Jeff. Steve, what does the National Alliance to End Homelessness do?
Well, first of all, thank you for having me here. I've worked at the National Alliance to End Homelessness since 1997, and the very first thing I was assigned to was get more money for health care for homeless people.
We appreciated that.
Yeah. National Alliance to End Homelessness is a private nonprofit corporation that works with communities around the country to articulate best practices and the right approaches to reducing and ultimately ending homelessness. We do research, we coordinate research and promote research by private researchers to figure out what works well and what's best. And then we work on policy at the federal level and increasingly over the last couple of years at the state level and a small number of states, with probably a larger number of states over the next year.
Thank you, Steve. So let me start with a question for all the panelists. Please just respond. We have set the problem this morning of how do we thread the needle of consistency at the national level, some level of overall policy direction, but a recognition that these programs are typically implemented and sometimes funded at the local and state levels. How do we thread that needle? What are some of the challenges that you guys have experienced in your very long and successful careers in terms of making that marriage happen between federal overall direction and local and city and municipal direction? And Jeff, maybe can you kick us off?
I think we're at a real crossroads around homelessness in this nation. There's a public weariness, I think, and an anger and a kind of nasty vitriol that is pointed at people who are homeless. You hear just language that is incredibly dehumanizing. You see business owners on the streets of San Francisco pointing a hose at a mentally ill woman who's sitting on the sidewalk in front of the business. We see murders and attacks, and I think that's a symptom of something. There's a real just us-them mentality and a real anger that is, I think, wearing thin the compassion that we should be experiencing as a nation. I think there's also a real movement towards, or back towards criminalization of homelessness, where many communities are passing really harsh laws that arrest people simply because they have nowhere to sleep at night. At the same time, there are some incredible bright spots. There are people exiting homelessness every day. The programs that are getting people into housing and providing good wraparound supports are really working. We just announced an additional 8% decrease in veteran homelessness last week, and that success of decreasing veteran homelessness by more than 55% over the last dozen or so years is a testament to housing first of all, that we know what works to get people in housing and provide services. And it's a testament to the fact that when you pay for stuff, when you actually do provide resources for housing and healthcare, good things happen. And the other bright spots we're seeing are around some really innovative work on youth homelessness, on homelessness prevention, kind of going upstream and keeping homelessness from starting in the first place. So there's a lot to be hopeful about, but it feels like we're kind of at this crossroads where things can tip a pretty dark direction if we don't come together to make sure that we're shining a light on the stuff that's working, the hopeful things, the positive things, and really invest in those. I think what needs to happen over the coming months and years is real local leadership to do that, to hold firm to what's working, to keep pushing in the directions of humanity and compassion and effective solutions, and not give in to some of the noise and the rhetoric that's happening up here.
Bobby, the Healthcare for the Homeless movement is maybe the best example of a very productive collaboration between the federal government, policy and funding, and localities that implement these programs. Tell us a little bit from your career. How do you see that working? What's been successful? What needs to be improved?
Thank you. I think it's helpful for the overall framework for the question is to recognize that the federal government is really important in that they set both funding levels for all of these programs that are funded federally but implemented locally. And also they set some of the general parameters of what you can and cannot do. So one of the really important things about healthcare for the homeless is to recognize that there is a bi-directional effect going on. Things that affect at the federal level, happen at the federal level, impact the locally, but also some things at the locally that are successful the federal government can take and put that to scale. And the Healthcare for the Homeless program is one of those. Started in 1985 as 19 cities in a pilot demonstration program. Care for the Homeless was the one in New York City. Immensely successful. The federal government said, this is working, let's replicate this, let's fund this. So now there are 300. So they set the funding levels, and then they also set the parameters, what you can and cannot do. So one of the things for Healthcare for the Homeless is they said you must meet all of the needs of any federally funded qualified health center, but also you have to do outreach in some way. You have to provide mental health and substance use services, and that's been since it was received federal funding in a more comprehensive way since 1996. So that is really important. They set parameters that everyone has to do across the country. Then each city, each locality, each organization will figure out how can we do this best to meet the needs of our population. I would like to say also, and just setting the general parameters, that I like to say that homelessness is the result of, the problem is the result of failure policy at the federal level that is felt locally. And also we can see the same for immigration. Immigration is a failure or a crisis of federal policy, but it's felt at the local level. So that's why it's really important that localities figure out what is best that they can do, but we need to understand we need the federal funding, both for healthcare, both for immigration, for housing, and the lack of federal funding is what has put us in these crises over the last 40 years.
Steve, the National Alliance has been one of the key conveners of conversations between national and local leaders, and really an outstanding multi-decade track record doing that. From your perspective, same question. How do we thread that needle between integrating federal policy and local policy and communication?
Well, I think it's going to be very important to understand, to have everyone understand sort of what works, what gives good results. We're not sure yet, but I would say it's pretty likely that what we're going to get from the federal government over the next few years won't necessarily really be in line with what research shows and what community experience shows works. So it's going to be more and more important for that message to come from the local level. Not only do we need funding, but we need funding for this particular group of practices that in our experience, and our reading of research is what actually gets good results. So I think that's going to be important. And then at the same time, it's going to be important that the people making decisions at the federal level understand that this is a very important issue for communities, and it's got to be taken on with the idea that we're going to have results. We'll talk about criminalization more later, but when I started to know, New York City was a center of criminalization of people who are homeless. And what people figured out, what many of you all figured out, was that was a big waste of money, and didn't provide results that were worthwhile. And that sort of messaging got across to everybody. If we really don't want people sleeping on the streets of our cities, we need to do what works.
Yeah, and interestingly enough, I'll be a little bit jingoistic here, but permanent supported housing was kind of invented here in New York, right? The Franciscan Friars on 31st Street, and then it's now become the national best practice, right? And so, do you see that in other examples where policies have trickled up from the locality to the federal level?
Always. Everything that is now considered a best practice nationally was somebody's idea at a local level that tried something out and this really works and really gets good results, and it expresses a sense of compassion, which I agree is important. permanent supportive housing, rapid rehousing, the whole idea of healthcare for the homeless, street medicine, all these things are things that started at the local level, outreach, and that we need a context, and hopefully the Alliance will continue to provide a context for those ideas and sort of global level and be implemented.
But it's more than a content. It's great because it's a content, but you guys also provide a role of ratifying these things, right? You submit it to testing, and you identify best practices, and then use your conferences and other communication tools that you have to promulgate those things across the country.
Yes, we do. That's an important piece of it. Hope everybody's coming to our conference. Yeah, that's the LA conference. So we'll have a conference in July in DC. Sign up early.
So the birth of the Interagency Council, if my history is correct, was sort of a recognition that homelessness is a multi-factor problem, and that government tends to view things in silos. And the Interagency Council was really a very progressive move to try to put somebody in charge of integrating all those services. So talk a little bit, because most of us don't know what the day-to-day work, what is it like to bring all of these cabinet agencies together to try to pull the rope in the same direction, Jeff?
Yeah, I think the first point I'd like to make on that is that U.S. Interagency Council on Homelessness was authorized under Ronald Reagan when he was president, and has had a strong bipartisan history of working well, regardless of who's in the White House. So over the last nearly 40 years, I think this agency has provided some stability to homelessness policy nationally in a way that was not politicized, that was not partisan or the kind of right versus the left with the pendulum swinging between them. I have some concerns about that now. I think the issue of homelessness has been much more politicized in recent years, and we can get to that as well. But the reality is that these federal agencies are big, they're complex, they're bureaucratic, there are a lot of funding streams. I think there's something like 42 or 43 federal funding streams that focus on homelessness. That's a lot, right? When you think about all the things that are happening around health and behavioral health, housing, education, labor, veteran services, all of these things. So the goal really is to get all of those folks talking to each other. And we do that at the cabinet level. Our council, our leadership council, is made up of the cabinet secretaries. What that does is elevate the issue so that when Secretary McDonough at the VA is working on their priorities, homelessness is up here because he was just in our meeting last week. We get progress where we see HUD and Health and Human Services working together on initiatives around Medicaid and supporting states to really use Medicaid waivers to help folks who are homeless. And so I think the real success of it is when we get those agencies talking to each other, pointing the same direction, and committed to actions they can take. And then we have the wonderful honor of working directly with the White House on this too. So the White House brings the weight of its convening power, its leadership, its kind of bully pulpit for mayors and governors and others, so that as we're shaping federal policy, we're kind of bringing all of those groups along, both federal agencies and then state and local leaders as well. It's actually a really cool mechanism, and we see some states implementing that really well, where there's state interagency councils that are also working across state governmental agencies kind of in parallel.
One of the ways that that's played out in New York City and elsewhere, but in New York City, which we're most familiar with, is in the work to reduce veteran homelessness, particularly veteran street homelessness, VASH. And so how did that come about? That's really bringing together funding from 3 different federal funding streams. And I know we'll drill into a little bit more detail in the second panel on this, but from your perspective, how did that come about?
Yeah, I may be a little, I may gloss over some of the history here, but in about 2005, the U.S. Interagency Council launched a chronic homelessness initiative that included HUD, VA, and then 2 components of HHS. One was FERSA was part of this, the Funds Healthcare for the Homeless, and then SAMHSA, the Substance Abuse Mental Health Services Administration. And this was just like a kind of test case of work in 10 communities across the country. I think that planted the seeds for what would become HUD-VASH and supportive services for veteran homelessness. The Obama administration then kind of supercharged that and said, we're going to dedicate a funding stream. You probably have We're going to dedicate a funding stream to this where HUD provides the housing vouchers, VA provides all the wraparound care. And over the last 12 or 14 years, we've had bipartisan support for that. The funding has increased. We've put tens of thousands of vouchers out into communities, and veteran homelessness has been reduced by 55%. This is not rocket science, right? When you provide housing for people, and you provide wraparound supports for people, Renee Mitchell and everybody like that, good things happen. They get housed and they stay housed. And so I think veteran homelessness, because it's more palatable across the political spectrum, is easier to fund in a lot of ways because people are perceived as deserving of housing because they serve the country. I hate that concept, by the way, but that's what happens in conversations sometimes. So we've been able to sustain growth of that program. We paired it several years ago. We collectively with supportive services for veteran families, which is much more flexible around grant housing and other kinds of subsidies, and it's really worked. What my hope would be long term is we could apply those lessons to all of the other populations and say, what would HUD vouchers like for families? What would HUD vouchers like for youth ranging out foster care? It's taking the recipe that was worked on that and applying it to all of these other groups. And it's hard to move bipartisan support on the Hill for that, but that's absolutely the direction we can go.
So, Bobby gave us a little bit of the history of the healthcare for the homeless movement. It was actually first funded by the Robert Wood Johnson Foundation, the Pew Charitable Trust, and this is one of the relatively few examples that I can point to in my career where government adapted and mainstream a really useful pilot performed by philanthropy. So, and what's ended up happening is we've got multiple funding streams from the federal government, right? We've got the HRSA 330H grants that organizations like Care for the Homeless benefit from, but we also have integrated Medicaid into that. And to some extent, this is sort of, we've had to figure that out, right? We need to figure out how to make the machine work. How prescriptive should the federal direction be? How much latitude should localities be given to do this? And in our case, how much should individual organizations, not even localities?
Yeah, that's a great question because you want to allow for innovation and you want to allow for people to contextualize their services to the needs. At the same time, you want to have standards. That there are things that are non-negotiable that you have minimums. So striking that balance is really important and sometimes very difficult. But I'm giving an example of HRSA with the 330H programs. There are 300 healthcare for the homeless programs. There are 1,400 health centers. But the federal government has standards. You have to, one, see everyone with regardless of their ability to pay. That's standard. That's why you have your grant. You also have to make sure that you meet certain quality indicators. So you want to make sure that you are focusing and you get measured on these quality indicators. So you have to meet a certain number of people for the amount of money that you're given. So those are the guidelines, and I think that's good. That brings accountability. That's reasonable. And then they can be flexible. But then within those parameters, you can find very innovative ways to do it. So many healthcare for the homeless programs, well over half do street medicine, serving people outside of the four walls of the clinic. It's mandated that you have to do outreach in some way. People do that in innovative ways. Some will send community health workers, people with the lived experience of homelessness, to do outreach and then bring them into the clinic. Some will establish a clinic in an area that is like the equivalent of Skid Row in Los Angeles. There are 3 healthcare for the homeless programs that have their main organizations, their brick and mortar clinics on Skid Row. So there has to be some innovation, flexibility for that. I want to go one thing just to pick up on what has been mentioned before. We talked about Medicaid, the importance of Medicaid funding. This is one of the things where Medicaid has certain parameters, and states can have to meet those requirements, but then they can apply for waivers in exchange for showing that will further benefit the people receiving Medicaid in their locality. So one of them is where New York City and New York State has taken the lead And this is when we were doing Medicaid reform from the second Governor Cuomo. And New York State put in a request to the federal government that we want to have it waived, that we can't use funding to support housing. We want to waive that. We're going to ask for that to be waived so that we can use our funding for supportive housing. Some of our Medicaid dollars for supportive housing in certain ways. And New York State got permission. They did not get permission to use their federal share. The federal government provides 50% in New York State, and then the locality, New York State does the rest. They say, we can't use the federal share, but you can use your state share for that. First time it was done in the country. Now they've gone further and further, where many cities and many states now are able to use more and more of their Medicaid dollars to provide support for people coming out of hospitals, have 3 months worth of support, 6 months worth of support, people transitioning from prisons to give them some stability. They realize that housing is healthcare, and that's the justification. More and more they're recognizing you can have more flexibility within the parameters to use your Medicaid dollars. States can do that to provide housing assistance for people. So that's an example of flexibility that's growing, and a lot of it depends on the administration at the federal level, what they will allow, but driven by the local level upwards to the federal level.
Jeff mentioned the bipartisan support for the Interagency Council, which has been really a component of it. There's also been a huge amount of bipartisan support for the community health center movement. This has not been something that's been controversial. People have seen this as an overall value. Bobby, do you see this being threatened as we move into a new administration, particularly with some of the rhetoric around work requirements to receive Medicaid and other things of that nature?
No, that's a really great question, and it's one that we at the council are struggling with and working on, talking to our partners like Care for the Homeless and the other 300 Healthcare for the Homeless program. What are you seeing? How can we help support you? So my short answer is I think the funding, barring any kind of slash and burn at the federal level, which would take Congress to say we're going to do massive cuts. Barring that, I think the base funding for the community health center movement will continue. It's very popular. There are over 1,400 health centers, several in every state. Congress people like having them in their district, and they like the funding and the services they're providing. So that's one of the reasons it's had great bipartisan support. Medicaid. Previously, there was an attempt to get rid of Medicaid. Congress, states rallied around and protected it. In this current environment, I am not sure. I think the biggest challenge will be how will we change Medicaid through things like work requirements. This incoming administration has shown that they are very much inclined to support work requirements. For the record, the council views healthcare and housing as human rights, and so which means that the only requirement that you need to meet is that you are a human being, not that you are willing and able to work in order to get a basic human need met. So that is a real big concern because Medicaid funding, this is a big problem. 10 states have not yet expanded to make Medicaid available for single adults, so it's only for children and their moms and pregnant moms are the only for those states. So this is a big problem. But for where it exists, Medicaid comprises about 40% of the funding for healthcare for the homeless programs across the country where they are in Medicaid expansion states. So if it was required that work requirements be done, even if they have in the past have exempted like people experiencing homelessness, there are bureaucratic hurdles to overcome that would basically prevent people from receiving care.
And by the way, just to before we get too precious about this, in our progressive state, New York, which is the most generous Medicaid state in the country, we mounted a significant effort in the last legislative session to try to get Medicaid to cover people who are migrating into the city, and we failed in New York. So, we is also a fight that we're having at the local level. In her opening remarks, Cynthia mentioned quite eloquently that housing is not the only thing that we need to solve homelessness, that we need a range of services. And that is, I think, something that we all simply believe. But housing is essential to the solving of homelessness. So Steve, what can we do to increase access to affordable housing at the national level, and what are the tools that the Alliance has been advocating for to increase people's access to be able to afford a safe and decent place to live?
Sure. Well, so let me start with just like a quick overview of the federal housing programs. These are the federal government funds two kinds of things. One, it gives people money to pay rent. That's largely through the Housing Choice Voucher Program, known in the old days as the Section 8 program. People are probably really familiar with that. It's a big part of the work on veterans' homelessness. So money to pay rent. But the other thing the federal government does is it has programs that pay to build buildings, build new buildings, rehab existing buildings, to make housing more available. So the important thing is to actually make more housing available. And that's the problem. We just don't have enough housing that people can afford. That's why people are becoming homeless at an unprecedented rate. That's why it's so hard to move people who are homeless into housing. The federal government needs to fund those programs at a more realistic level. I mean, the Housing Choice Voucher Program is funded at a level that meets about a quarter of the need for people who are eligible. A quarter of the people who are eligible get a voucher, the others sit on a waiting list. And it's been a quarter since I started doing this work, like a long, long time ago. So that is one thing that's got to be a concentration, is get the voucher program up to a level that's more realistic. And the same is true of these housing development programs. There's a number of different programs that fund either nonprofits or fund local government, who then usually turns around and hires nonprofits to do the work. There are development programs. The National Housing Trust Fund is a smaller program right now that we hope to make bigger. The home program at HUD is more of a block grant to local communities they can use for housing. The low-income housing tax credit, of course, people are familiar with, very complicated program, difficult to use, but it's a tax credit. So when Congress debates it, it's a program that cuts taxes. It's not a program that increases spending. So believe it or not, that makes a big difference in advocating Congress. So it's important for people at the local level to make sure their members of Congress understand how important all these programs are to making housing available for people who are living on the streets. I mean, it's like the question really is pretty cut and dry. Do you want people living on your streets or not? And if you don't, then you need to have housing available so they're not. You need other things too. If you're talking about people with severe health needs, then they need health care that's going to pay for that. I mean, it needs to be coordinated with the housing. But if there's no housing, you know, the healthcare programs just don't really get the results they need if people are going to, you know, get their healthcare and then just stay on the street.
And in a fantasy scenario, we have lots more federal dollars to spend on this. We also are now engaged in a debate as a country about where these affordable and supported housing programs should go. And there's been a very significant movement from localities to push back against these using various restrictive zoning provisions or just plain out NIMBYism. So is there a role that the
federal government could play, and they have played. I mean, under Secretary Fudge, for example, there was quite a bit of enforcement. But is there more of an enforcement role or a prompting role or a holy pulpit role that the federal government could play to get local communities to take advantage of those federal funding streams?
Yeah, I think there's a number of things that we've seen from the federal government and some other things that we've never seen from the federal government that are at least possible. I mean, I think that the bully pulpit idea is a good one. You know, it's like we're members of Congress, if federal agencies are saying we're hearing from communities, you don't want people living on the streets of your communities. We know in order to fix that, we have to have more housing. So you need to tell your mayors and city council members that the NIMBY thing has just got to stop. That kind of messaging, yeah, we all agree on that. I know we all agree on that. So it's like, can we get our members of Congress to tell our mayors and city council members that? Then I think there are you could, as you mentioned, Secretary Fudge, there are, you know, at some level you get to fair housing violations. And there's a litigation approach that can be taken when the NIMBY is extreme. There is the Fair Housing Act of 1968 includes a provision that communities should use their federal resources to affirmatively further fair housing. There's never been.
But the enforcement provisions were only added in 1972.
The enforcement provisions are only added in 1972. They've never been really enforced. We've gone back and forth with the new administration. I think people who work on that issue are thinking we're probably not going to get anywhere with that. But it still, again, provides some ammunition to talk to local communities about, you know, what are they making more housing available to people with the lowest incomes, to people with disabilities, to Black and Latino people. That's another way to talk about this.
Thank you. You know, one of the sad things about living in New York is you live in New York. One of the advantages is I get to know that there are things outside New York and ways of approaching. So looking at this from a national perspective and some of my experiences working at that level, including on a federal task force around health equity during COVID, one of the things that really hit me was the power of the purse. So if you attach funding to what you want to happen policy-wise, you're pretty sure you have a good chance of it happening. And also, you can also, if you tie that funding to what you want measured, you can be pretty sure it's going to be measured, and then you can see progress. So just as an example, I'm on the Nashville Continuum of Care committee around race equity. And one of the things we haven't yet mentioned is the tremendous racial dimensions to homelessness, which is driven by our racist policies. So HUD funds each locality and gives and has a continuum of care. New York City has one, it used to be part of it, and this body decides what their priorities are going to be, how the funding is going to be. But they have to apply every year to the federal government for it, or so often. And one of the things the administration has done has said, you have to show, we're going to give you a point on your application if you're showing that you are measuring the racial implications, see if there's race equity in your outcomes. And now people are starting to do that. And then you can say, and then we will incentivize you if you are showing good results, as an example, or we will penalize you if you're not. That is one way, in addition to enforcing existing laws, that even from an administrative level, in an administration, you can drive policy change to get people to do things on a local level that you feel should be done based upon the federal priorities of the administration. And it's just not done enough, I feel. We can really be creative using the funding that we're providing to help. Now that can also be weaponized in other ways to punish, but just don't want to overemphasize the power of funding and then to drive what is measured and how we will reward people for that.
Can I pick up on that? I'd like to pick up on Bobby's example of HUD putting racial equity in the continuum of care application. The backstory for how that came into being was that for a long time, HUD and others were really not looking at racial disparities in homelessness. And people had written about this over many years, but there really hadn't been much action on it. And beginning in about 2014 or 15, a group of us started coming together to really shine a light on this, and ended up in a lot of conversations with HUD showing data from around the country and saying, hey, Black folks in America are 3 times overrepresented in the homeless population, Latino people are increasing in the homeless population, Native people are overrepresented at a rate of 5 to 1 and even higher in many places. And the good career staff at HUD, I'm not talking about the secretaries, because these conversations were actually happening during the first Trump administration. And the good, dedicated career public servant staff made that happen during the first Trump administration. And when they put that language in the continuum of care application, local continuums of care started behaving differently. They started asking the question, oh, do we have a lot of Black folks in our homeless system? Sure do. And once you see that, you can't unsee it. And the good people who are in this work then are feeling drawn to not only score well on the COC application, but to begin to right some of those wrongs. And in the wake of that decision, it was a simple decision. In fact, I had the very weird privilege of sitting in a hotel lobby during probably one of your conferences with the HUD staff crafting the language for that. And then I saw the change that happened over the next couple of years. And what has happened since then is that Black homelessness nationally, if you look at the last HUD report to Congress on this, it has decreased by about 4%. Now that's not perfect. We're nowhere near eliminating racial disparities, but it is a step in the right direction in a really big way that was shaped by outside advocacy, influencing federal bureaucracy, driving local change, and creating better outcomes. That's a really good story, and it happened during the first Trump administration. That's really weird.
You can even back that up one step further, right? Because I reflect on this with some frequency. Richard Rothstein and Michelle Alexander wrote important books about housing, racial inequity in housing and the criminal justice system, neither one of whom was focused on homelessness. But those 2 books have informed our perspective on homelessness in ways that are way out of proportion to what either of those authors really, I think, intended. Tough question, Steve, but I need to ask, and if you want to say, I'm not going to answer that, that's fine, but the Republican campaign was a little light on details from housing policy perspective, and how they're going to increase the supply of housing in the United States. Any tea leaves that you can read on this? Because maybe they are supply side. So if you just build more housing, there'll be some trickle down. But what are you thinking in the next 4 years in terms of housing policy coming out of the federal government?
Yeah, I can definitely answer that. Although it's not going to be a lot of details, as people know. There's
Your crystal ball is better than all of ours.
Yeah, there's no announcement yet of who the HUD secretary is, right? Unless it's happened while we were sitting here. The announcements, we as Bobby noted, I think for a good long time we've gotten a lot of support from the healthcare world for better housing. We do know who's in charge of the healthcare world at the federal level now. If Congress approves these people, and what they'll think about that is like anybody's crazy guess. So we're going to continue to push the idea that that housing is the key to having less homelessness, and that homelessness is bad. That nobody likes the fact that people are living outside. And the people living outside don't like it, and neither does anybody else. So rather than like pointing fingers and trying to decide who to blame for this problem, let's just solve the problem. we'll see how that goes. I mean, you know, if it doesn't work at all and they start promoting really bad things, then we'll have to fight against those bad things like we did in the first Trump administration to great effect, I would say. I mean, the first Trump administration, for the first couple of years, they didn't really pay much attention to homeless services at all. Then they started paying attention to it, and it was all like bad ideas that had a lot of criminalization. And we fought that at the federal level. People all over the country fought it at the state level, and to a very large extent, we were successful. The worst ideas didn't really get implemented. Now, recently, some of the criminalization has had a comeback in many places. So we'll have to continue fighting that at the local level. But I think that we're, you know, we start with the idea that we know what's right, and we know that nobody wants what we have now, which is thousands of people living outside. So, you know, we know the solutions to this. Let's implement those solutions. If that doesn't work, then we'll try something else. But I think a lot of it is going to be, it's going to be more at the state level. It's going to be more at the local level, and really, you know, communities learning from other communities what's going on, rather than I'm not sure we're going to be able to count on HUD to sort of force those policy communities to do those policies.
And I'm hearing that they've, for HUD Secretary, they've narrowed it down to Hulk Hogan or Tony Danza.
I used to like Hulk Hogan. I watched him. I wonder if I went to him and said, "Yeah, I used to watch you."
So I do think there's common ground to be had on the housing supply side. You know, when you hear both candidates, as different as a Harris campaign and a Trump campaign were on all sorts of policy issues, they were both talking about housing, which was kind of extraordinary. My concern is that what housing might mean for folks in this next administration is, you know, high-end development, you know, upper end of the income spectrum. I think part of our job in shifting that is targeting it as deeply as possible into extremely low-income folks and making sure that housing is being developed all up and down that income ladder. But I do think there's room for common ground.
So let me ask a final question, and we'll get to the audience questions of each of you. What is the one thing on your organization's advocacy list that you would think would have the greatest impact on that 683,100 people living without homes in the United States? Bobby.
I'm going to go off script, and because we have a formal policy advocacy list, but I'm going to give mine. And this is, it's not on it, but no one will really disagree. It's important. I think when I think about the interaction of healthcare and homelessness, where we can make the biggest difference is helping to make sure there is a healthcare lens in the homeless response system. So it is woefully inadequate in the continua of care across the country, which sets the priority of how we're going to spend the federal funds that come in through HUD, and how will we, on an individual basis, assign priority to who gets homelessness, who gets housing first. So there are very few healthcare providers around the table in most COCs around the country. The data that is collected around healthcare or the health status is very inadequate. So we'd really love to see, especially given when we're talking about chronic homelessness, which is a subset, a small subset of the total people experiencing homelessness in the year, but that's what's in the public mind. The person who has mental illness, substance abuse, has been living on the streets for many years. They have a healthcare problem. They have healthcare needs that are not being met and not being reflected adequately. So we'd love to see a way really mandated, encouraged by the federal government, by the policies at HUD for the COCs, that they collect better data, that they use it better, and that it helps to get those most in need into healthcare and into housing, that healthcare needs are better estimated. And A plug for one of the big things that really should be part of every continuum of care is medical respite, which I mentioned before, and that is really for people without homes who no longer need for a clinical reason to stay in the hospital, but are too ill to come back to a shelter that can't take care of them, a friend's couch, or in much of the country, all too often the street. Getting that integrated into the homelessness response system at the COC level, I think can really make a big impact, especially for people who are chronically ill.
Thank you. Jeff, what's the key thing on the advocacy?
I'm going to answer your question, but I want to say a quick word about the future of our agency first, and I'll come back to this. We have some extraordinary career staff who have dedicated their lives to public service. One of those is my amazing colleague, Michelle Carter, who's here. Michelle is our senior regional advisor for the Northeast, so she covers New York. And Michelle and her colleagues and all of our staff provide continuity of thought, of support for communities, of kind of stability to the federal bureaucracy. Then there are those of us who come and go. And as a Biden-Harris appointee, I will be leaving in the next few weeks. So there'll be new leadership coming in to take over USICH, to take over all the other federal agencies that serve as our cabinet leadership. And I don't know what all that means. I can speculate about it. I can have days where I fear the worst. I can have other days where I hope for the best. I have other days where I think, okay, what do we do as advocates to shape that? But I'll be moving back outside of government and trying to shape things in that way. What I hope carries forward, and this gets to your question, we're not an advocacy organization, we're a federal agency, but we've been pushing really hard on homelessness prevention. And I don't know if you all have tracked this over the last couple of years, but in our federal strategic plan, there's a very strong prevention pillar. In our federal research agenda, which we put out for the first time in more than a dozen years, it's half dedicated to homelessness prevention. We just put out a federal prevention framework, the first ever homelessness prevention framework at the federal level. And we're beginning to spotlight communities that are doing really good work on prevention. To me, the key to making the number go down is to keep doing the stuff that's working to move people out of homelessness, scale that up, but we have to pair it with an upstream prevention strategy or we will be bailing this bathtub forever. And if we can begin to stem inflow, then the number goes down as fast as we can help people exit homelessness. So we've got to get into a both-and mindset around emergency response and upstream prevention. It can't be either or.
Thank you, Jeff. Steve,
Well, I've cheated, give a couple of answers because it's like we're, as I said, there's a lot of uncertainty about what is going to be doable in the next couple of years. I mean, the important thing I think is to take this housing choice voucher program and make it a universal program. I mean, I'm sick of, after decades of hearing about how it meets 25% of the need. I'm just like tired of that. This is a basic human need. It's the main way the federal government has to pay for housing for people. They should just pay for it for everybody. I do not have any great illusions about that being on the list of the new Republican majority in both houses of Congress. We'll see if we can get them on board. But if we don't, there's a couple of smaller things. I think like some very tiny things, but I think that are very helpful are things like we've done in the continuum of care system to make the running the system at the local level better. The 2-year NOFO is a good idea that I think is going to be continued on by the next Congress, although I'm not sure. I would just, one thing I'd like to add to what Bobby said about the homeless lens, healthcare lens within the homeless system. We're going to be talking a lot about veterans homelessness in the next year for all the reasons that Jeff articulated. The homeless programs at the VA are embedded within the healthcare system. There's not a housing system at the VA. There's a healthcare system at the VA, and healthcare is who does homelessness at the VA. And that's one of the reasons that veterans homelessness has been so successful as they have been, and we need to do that with all the rest of these programs. So.
Thank you. Questions from the audience?
I have a question.
We're gonna go through here. Thank you. All right. What federal investments are being made in innovative programs such as mobile health units or integrated care models to support homeless individuals with substance use disorders? What specific federal strategies are being implemented to combat the opioid crisis among homeless populations, particularly in dense urban centers like Manhattan?
Anybody?
That was a multi-part question, so I'll try to answer at least the part that I remember and know the best. One of the great innovations in healthcare has been the adoption of medication-assisted treatment as a way to treat opioid disorders. It has, when someone gets that healthcare, their chances of becoming clean and staying sober are tremendously improved. And one of the things about healthcare for the homeless programs is that we have been leaders in that, within the larger federally qualified healthcare system, to the extent of like 10-to-1. So we have like 4% of the patients that are experiencing homelessness that are served, but we are providing 40% of the max services in the country. And one of the things we are trying to do is take the lessons that we have learned in healthcare for the homeless, care for the homeless and other organizations, and then to spread that. And HRSA understands that, and we've done that. So one of the things I'm really thrilled about in a recent piece of federal legislation is that they have removed the barriers to providers providing MAT services. So that is one of the things that I think has really been helpful at the federal level to change that. It was a law, but HRSA has been pushing that within health centers, and now they're requiring that all health centers, start providing substance use services and mental health services, which for the first 50 years was not a requirement. So recognizing that these are things are really important. So that's the federal government driving those changes and supporting them with funding.
I'll just add a couple of things. This is kind of wonky, but one thing we were able to do was to get a Medicaid location code for street medicine. And what that's done is allow local healthcare providers to bill Medicaid for that service when you're taking healthcare out on the street to people. And I think that it just opens up a funding stream and sustainability for that. This is another space where I think there's possibility of bipartisan support. I think around mental health and substance use, there's a recognition that we just need more. We need more medication-assisted treatment. We need more detox beds. We need more, residential mental health programs. This is going to be in tension with desires on the Republican side to cut federal budgets, and I think that's where the tension is going to be. But I think in terms of recognizing the need for greater behavioral health support, it's there across the aisle.
Sorry, I was broad way to answer. Federal policy and funding focuses on specific populations like veterans or seniors, and they are prioritized over single homeless adults. How can we reduce these siloed responses?
Well, let me start with that one, because I think that's a frustration we've had for a while as we've seen this children population growing. There are certain sort of pots of money that are focused on specific populations. There's no question about it. Mainly that comes from the U.S. Congress. They get lobbied to do that, and they get a lot of support for that. And it's not, bad. Money for homeless youth. I mean, homeless youth are very vulnerable. So it's hard to say, oh, that's a bad idea. It's hard to tell a member of Congress it's a bad idea to do funding for homeless youth. So the point is, if you're going to do that, you need to make it as effective as possible by really focusing on the people who have the most severe needs. And then we have to make sure that some of the more general programs, like the continuum of care, or like some of the housing development programs, people need to understand that those sort of focusing them on specific populations that are maybe more politically popular, that's not the problem people are seeing now. The problem people are seeing now is people on the street, single adults living on the street, often with very severe healthcare needs. And that message needs to be conveyed to people in Congress who are making these decisions.
I think in the big picture sense, the answer is universal approaches. And Steve, you talked about universal vouchers. Let's give housing vouchers to everybody who needs it. Let's give healthcare access to everybody who needs it without work requirements. The kind of operationalizing what it means for housing to be a human right or healthcare to be a human right. Politically, that's really hard to pull off. And so I think there has to be some real thoughtfulness and strategy around how you kind of drive change. What we try to do in President Biden's budget the last couple of years, we put in a proposal for universal vouchers for every extremely low-income veteran and every extremely low-income, every youth agent in foster care. Now, you could argue that that's shoring up this siloing that the question's talking about, but what we were trying to do was a test balloon to say, you know, if we could provide universal vouchers for some people, can we scale that up to everyone? We also made a choice at USICH when we wrote our plan not to organize that around subpopulations, which some previous plans had done. So we didn't have a section on veterans and a section on families and a section on youth. We said we need prevention for everybody, we need housing and supports for everybody, we need to address racial inequities across the board. And so that was a shot that we were taking at kind of blowing up some of these, choosing one population over another, which I think is a problem.
Although I will point out a slightly contrary perspective, which is something Jeff mentioned before. In certain instances, this has been a positive thing, right? We established a comprehensive integrated plan to reduce veteran homelessness, and we were successful in that silo. Now, the question then becomes, how do we take those lessons and morph them into the universal solution? So I think that there is some value in some of these specific silos because it allows you to develop best practices that they can be spread out.
That's right, and I think that was the kind of theory of change behind the Obama administration's Opening Doors plan, which was the beginning of the veteran homelessness work. So I think that was the idea. You show in one kind of test case that it's possible, and then you ripple that out to everybody else. What we've not seen is the rippling out to everybody else.
Thank you. In the light of the looming administration changes, what agenda items are realistic for the next 4 years? For example, can medical respite be expanded under current waiver options?
Yeah, that's a great question, and you know, just a bit of personal new information. I've been in care for homeless until left for my whole career. You know, the second stint was 22 years, so it gives you an idea. And what was the tipping point for me was between the time I accepted the offer was the election of President Trump in 2017. And I immediately was thinking, how can I switch from just protecting care for the homeless, but how can we protect all of the health care for the homeless program? So that was a big motivating factor. So, but once that happens, then you move into a defensive mode. You may have a lot of ideas you want to advance, but then how can we protect? How can we protect? So I think that will be a big part of it. Now there will still be opportunities to advance, like in, Jeff mentioned some career people at HUD that made advances in equity and said this has to be what all CLCs around the country do. So you still have some really great civil servants that really are caring and can do a lot of work, but in general you are protective. As far as medical respite in particular, I think in an administration that at least gives lip service to states' rights and want to give deference to the states, these are states-driven solutions that the states are proposing. We want to use our Medicaid dollars to support medical respite. I think what really helps is to the extent there could be better research. We have a lot of anecdotal information of showing how in isolated instances it saves money. Better for patient care, but to have that in a more universal way to really drive, to show the language of whatever the Congress is, with whatever your audience is, you have to figure out what is their pain point, how you speak their language. This will really be about saving money. So to the extent that can show that it saves the system money, I think that would be really helpful in continuing to advance great programs like medical respite.
Jeff mentioned the politicization and criminalization of homelessness at the policy level, coupled with violence and overt hostility towards people experiencing homelessness. How can we in the field work to change the story of deserving versus not deserving people and elevate housing as a human right?
This is, I'm sighing because it's hard work, but it's definitely necessary work and important. I think talking about the success that communities have had is going to be very important. There are different thoughts about telling stories about individuals. So like on one hand, you can find individuals who are real people and you see this really helps real people. And that's good. But some people say that, well, if you focus on individual stories, then that makes it look like a problem of individuals, when it's really a systemic problem. And I don't know the answer to that. I think more just more talking about the good things that the funding has paid for and the people working in the system have done, I think is going to be very important. And then it's also going to be very important to be able to talk about the bad things that people are proposing or that they've started doing. I mean, none of the terrible things that people want to do are new things, as we talked about criminalization, the long history of criminalization of homelessness, the long history of incarceration of people with mental illness. These are stupid ideas. I mean, we know they're stupid because we have a long history of them not working. They're stupid and they're mean, and we need to have the evidence on that and not let anyone get away with trying to say that, oh, this is common sense, because it's not common sense.
In New York, that history goes back to the Dutch colony.
Right, exactly. And someone had said something about the new administration. I would point out that it's not just Republicans that are saying some of these stupid things, and we need to get this across.
We must relentlessly bear witness to the humanity of people experiencing homelessness. Let me say that again in case my class is out in social media. We must relentlessly bear witness to the humanity of people experiencing homelessness. And I think one of the most important developments in the last few years in our movement is the leadership of people with lived experience of homelessness. And we've got folks in this room like Rob Robinson, like Renee Mitchell, like others who are doing this. And leading the way. I think that's critical, that when people who are in elected positions, positions of power, positions of holding funding, get to know folks as human beings, as equal human beings, as fellow human beings, it starts breaking down the us versus them thing. Those people, the homeless, all the labels that get thrown out. I think I still hold out hope that we can find each other's humanity across the political divides, across the religious divides, across the geographical divides. I think that's how we heal from this really divisive place that we're in right now as a nation. So I think around the messaging and the narrative reframing and all of the advocacy work, I agree with everything Steve said about holding up what's working and shining the light on the stupid things. It's also about reminding people what kind of nation we should and could be if we really took care of each other.
This is an addition, not supplanting anything that was said, but I also believe that one of the ways we can do that to emphasize our shared humanity, even for people who only see difference, is to appeal to shared values, especially what are supposedly common American values. One of them is that everyone should have a fair shot. So when you talk about that and say, well, how can someone really have a fair opportunity to achieve the best that they can be if they don't have stable housing, if they don't have a chance to get off the street, if they don't have a chance for health care. And so some of these common values that people espouse, and I believe they really hold, they don't see the contradiction. So to ask those questions and appeal to those shared values, I think is a really good way of helping to get people to see the humanity and the solutions that are not in contradiction to what you want to see happen. No one really wants to grow up in a society that has people living on street corners. You don't want that for your children, you don't want that for you, but people have grown weary, as Jeff said in his opening remarks, and I think appealing to the common values is a way to, common values and common needs is a way to help to bridge the gap.
Great. Thank you for everybody submitting questions. They're really good ones. I'm hoping to get to 2 more, so let's try this one really quick. Which cities are doing housing first best, and what can others learn from them?
I mean, I'll take a shot at this. I think there are a lot of places that are doing housing first really well. Dallas is on my mind lately, which has seen a 19% reduction in unsheltered homelessness in the last year through a housing first approach, moving people straight from the street into homes, not an interim staff, not a shelter, not a hotel. Houston has always held up as a model. I think they continue to do some of this very well. Minneapolis, Rob and I were talking about earlier, Hampton County, Minnesota, is doing just some incredible work on urban Indian homelessness, on family homelessness, on housing first. So there are good models all over the country. I think the challenge is how we scale those up. It's often we're doing housing first really well for 200 people when the need is 2,000 people or 20,000 people.
Great, thank you. And then the next one is, are there effective strategies of community organizing you've seen that help increase funding or driven progressive policy change?
I'll start. I know everyone has some good examples, but I'll speak from my example. When I was Executive Director of Care for the Homeless, and we were very active in lobbying, and yes, and we actually had a lobbyist, so I don't mind saying lobbying, which nonprofits can do, but going before City Council and in Albany, and I learned took me a while, but I eventually picked up, yes, they want to hear from me as the Executive Director, but what they really want to hear from is as soon as a person with lived experience of homelessness, as Jeff mentioned, walks into the room, that's who is the star. That's who they want to hear from. Second to that is a clinician, as a healthcare provider. If we get a doctor or a nurse practitioner, someone directly providing care to people, they want to hear that experience. They want to hear the frontline experience. And so what I found and we found is the most effective combination is to pair that. A clinician who's providing care to people with the lived experience of homelessness and a person with the lived experience. That has been a really powerful combination, going before Congress, going to some hearings, and it worked here in City Hall, it worked here in Albany, and that's my contribution.
Yeah, absolutely agree with that. Another thing is really work at getting your elected officials and their top staffers to come out and see programs, to participate locally, to sort of be part of the group of people at the local level who are working on this issue. That I think has been very effective. Members of Congress, they want to be associated with good things that are going on in their community. I mean, they have to run for House members every 2 years. They have to get thousands of people to come down and vote for them. I mean, if I had to do that to keep my job, I would not been doing that. So being associated with good things that are happening in the community is one of the ways to get people involved. And then once you got that person-to-person relationship with them and other people in the program and people who are being benefited by the program, then they'll you'll be able to call on them when it's time to do so.
So please join me in thanking this outstanding.
And I have the privilege of moderating this second session of Care for the Homeless's Policy Symposium. Thank you all for being with us. We are going to pick up on many of the key themes from this morning's, I would say, energizing and informative conversation. We are going to use a local New York City lens in reflecting on the impact of federal homeless policy and the impact of federal funding. We heard a lot in this morning's session about how empowering it can be at the local level in terms of impacting federal policy. So we're gonna reflect on some best practices happening here in New York City with respect to coordination across city, state, and federal government. And we're going to take the opportunity to get some early preliminary insights from our esteemed panelists on how they're thinking about navigating this new political environment that we all find ourselves in. So with all of that said, I'm going to briefly introduce our panelists and we'll jump right in. To my left, we are joined by Rob Robinson, community organizer and activist. Molly Park, the New York City Department, the Commissioner of the New York City Department of Social Services. Tori Lyon, the CEO of Jericho Project. Jonathan Santos Ramos, the Chief Program Officer at Care for the Homeless. And Tiara Labrada, the Associate Director of Advocacy and Outreach at the Supportive Housing Network of New York. So as a bit of a warm-up here, in the same way that George did with the earlier panel, I'm going to ask each of you briefly to talk a little bit about the work of your organization or the work that you do at an individual level. And let's start with you, Rob.
Sure, so thank you, and thank you all for being here. I have a unique entry point into this work. I have lived experience, 2.5 years homeless on the streets of Miami, and 10 months in a New York City homeless shelter. But this particular institution was a place that welcomed me to do some critical thinking with students in academia. And I think the continuum of care was the other place. As a member of Picture the Homeless, I would go to continuum of care meetings. I spent 12 years in that body, 11 of those years as a steering committee member, and it helped me to understand how services are being delivered from a federal perspective into the city. So I had a unique entry point. Neil Smith, a distinguished professor of anthropology and geography, was the one that brought me here. And I owe a lot to Neil, who passed away in 2012, but I'm sitting up on this stage, I say, because of Neil.
Hi, so the Department of Social Services is the largest municipal social services agency in the country. We're actually a hybrid of two separate agencies. The Department of Homeless Services, DHS, is the lead sheltering agency in New York City. At this point in time, we have about 87,000 individuals in our shelters at any particular point in time. Of those, about 59,000 are traditional in New York City individuals experiencing homelessness. The remainder are asylum seekers. And then the other half of DSS is the Human Resources Administration, which is the lead benefits agency for the city. Key among those, and probably what most people think of, are cash and SNAP, but would also call out among the many, many other programs that the agency has is that we administer rental assistance for about 70,000 households, including many people who are formerly experiencing homelessness. That puts us up around the 4th largest housing authority in the country.
Hi, Jericho Project is a nonprofit organization here in New York City. We serve the 5 boroughs. The work that we do mainly falls into 2 buckets, and we do serve primarily individuals and families who are literally homeless or at imminent risk of homelessness. And the first bucket is our supportive housing portfolio, which is close to 600 units now. And we have, they're mostly in the Bronx right now, but we have another 1,300 units in the pipeline. So we're going to be vastly expanding that. And I think most of you know what supportive housing is. It's affordable housing together with on-site services. So we provide, we call them wraparound services, case management, benefits assistance. We have a big workforce program, so we really, we try to focus on having people go back to work or do something meaningful that puts a little bit of extra money in their pocket, hopefully. And we also have special residences for veterans and for young adults, ages 18 to 25. The other bucket that we do is what we call our housing access programs, and those are, we have 3 main programs. We have a VA-funded supportive services for veteran families, rapid rehousing and homelessness prevention program. We have a rapid rehousing program funded by HUD through the Continuum of Care that serves young adults. And then our most recent one that we started up last January is for unsheltered families. And those collectively probably serve about, I'm guessing, I should know this off the top of my head, but it's around 700 people. So altogether, Jericho serves about 3,000 men, women, and children every year.
Our board member, Cynthia English, told you a little bit about us, so I will just kind of fill in the blanks, hopefully. We are Care for the Homeless. We provide shelter, healthcare, and supportive services to individuals and families. We have about 23 service sites across the 5 boroughs, and soon to be 6 shelters in 3 of the 5 boroughs.
Good afternoon, everybody. How's everybody doing? Good. You're awake? Fantastic. My name is Tiara Lebrad. I'm the Associate Director of Advocacy at the Supportive Housing Network of New York. We are a membership organization representing the nonprofits that develop and operate supportive housing throughout the state. Our mission is to support the sustainability and proliferation of supportive housing throughout the state, and we do that through policy and budget analysis, advocacy, outreach, technical assistance. I also serve as a member of the COC Steering Committee in New York City and the COC co-chair of New York City Continuum.
Quite a distinguished group of panelists. We're really excited to have you with us today. I'm going to throw this first question out for anyone who wants to answer it. Brag a little bit about effective collaborations that you've been a part of that collaborate across New York City and the federal government. Share some success stories with us.
So it was mentioned on the earlier panel quite a bit, but the veterans homelessness work that we've done here in New York City is a great success story. It started really under Michelle Obama. She did a mayor's challenge to all the mayors around the country to challenge them to end veterans homelessness. And both Mayor Bloomberg and Mayor de Blasio took her up on the challenge. And that really resulted in my 30 plus years of working in this industry, unprecedented collaboration between HUD, the VA, and the VA I think is the second biggest bureaucracy in the federal government. They're not always the easiest to work with because they have, I think somebody on the previous panel said it was a good thing that the HUD VASH vouchers, which are these Section 8 vouchers for veterans, was part of the healthcare system, but that also presented a lot of issues because they see everything as healthcare and we see everything as like housing and outreach and stuff. So, for example, they didn't know how to find housing in the community. So, Mayor Bloomberg, for example, personally met with a bunch of landlords in the city and implored them to house homeless veterans. He created a new department in the city of New York, the Department of Veteran Services. We had a veterans task force that was part of the Continuum of Care, and I see many people in the audience today who are on that task force. And we were able to, over a 5-year period, bring down veterans homelessness by 90% in the city. Yes. And it also included a lot of nonprofits and the government agencies. And, you know, as New Yorkers, I hate to say it, but we don't always play nicely. But this was a real collaboration. It was a meeting that you would look forward to going to because people would say, hey, I just got this rule relaxed, so it's easier for this veteran to get this voucher. Or, hey, I just got approval to hire 10 peer outreach specialists. It was really, really energizing and it really was effective. And I know that, we had some questions earlier in the panel as well about, well, if you're focusing so much on veterans and putting all these resources into veterans and what's happening to the other single adults and other families. And so that's definitely, unfortunately, we haven't really been able to replicate it. But it was really the federal government creating or issuing tens of thousands of new HUD-VASH vouchers. And that's what came into the city, and that we were able to work with the VA to coordinate how those were spent rather than just the VA kind of being in their silo. So I know I'm missing some stuff, but it was wonderful. And even today, we're still, veterans homelessness is still down. So I think the figure was 136,000 homeless people in New York City. Only about 700 of them are veterans.
So I think another piece that we need to talk about when we talk about collaboration with the federal government is actually the income support side of the ledger. And when we talk about homelessness and housing affordability, we tend as a sector to focus on how much housing costs, and that matters a lot, but also what other resources do people have and what is their total income looks like is part of the equation as well. And in New York City, we administer, for example, SNAP benefits for almost 2 million New Yorkers and cash assistance for almost 600,000. Those are overlapping populations, but in total, there's about 3 million New Yorkers across all the different benefit programs that we operate. We're administering them here at the local level, but these are federal programs. And I think, they aren't directly related to housing or homelessness prevention or ending homelessness, but if we didn't have them, the landscape would be that much more challenging. And I think it's certainly something that we need to be thinking about as we go forward. For those of you who may have, say, read the Washington Post yesterday with the threats to end SNAP.
I'll just give quick comments. I don't know if any of you noticed, but obviously I have a great relationship with USICH folks. Jeff Olivet is in the room. Nichelle Carver was here earlier. I got a call from a former person who worked at HUD, now works for the National Alliance to End Homelessness, by the name of Marcy Thompson, who told me that there is a new person that is going to be the regional director for the USICH, and I want her to talk and meet with you. So I get this call from Nichelle about 2 years ago, telling me that Marcy Thompson told her to talk to me. You're a person with lived experience who has a lot of knowledge about what's going on in New York, and I want the two of you to sit in a room and have a conversation. So those conversations were enlightening to me as a person with lived experience. You think you can't work with government, nobody's listening, but as Jeff clearly said earlier, the more you get in those spaces and have conversations with elected officials, the more you get buy-in from those folks. So I'm kind of proud of the fact that I got to work closely with them and still continue to work closely with them. But I'll shout out another person from National Alliance to End Homelessness, Anna Leva. When she used to come to our Continuum of Care meetings in New York, she would always pull me to the side, ask me a bunch of questions, and we formed a relationship. So I think it's possible to build off of these relationships, but you have to prove that they can work, and particularly for people with lived experience. You have to be able to open the door and say, this is going to be a good conversation. Come on in here and have the conversation with these folks.
I think that the federal government has done amazing things, but one of the things that HUD did with the Continuum of Care, which we'll talk a little bit about in more detail in a minute, is the requirement that nonprofits, mission-driven nonprofits, are the ones that are getting awarded the funds to do the services and provide supports. They are the ones closest to the ground, in the community, and know what the community needs. So that's one thing. And then another thing that I think that has been wildly successful while still in its infancy in New York City is the coordinated entry system. So this is a requirement that the federal government has put down through COCs, that you have to assess and prioritize individuals who are entering into the continuum of homeless services in a coordinated way. So shelter providers and supportive housing providers and transitional housing providers all have to talk to each other. And what New York City has done is create the coordinated assessment and placement system, which in my experience is one of the most sophisticated, while again, still in its infancy, still has a lot of work to do to live up to its full capabilities, is one of the most sophisticated and robust placement systems that I've seen. And so I think that with continued resources and iterations, we have the ability to really create a robust system through the COC and CAPS.
As a healthcare provider, a federally qualified health center, as an FQHC, we are funded by HRSA, the federal government, to be able to provide care locally. And so connecting that care and partnering with DHS, for instance, and connecting with our co-located partners in the shelter system has been one of the ways in which we've used the federal funding locally. But one of the things, and I see some BronxWorks folks, so shout out to y'all, our partnership with BronxWorks, where we have done MAT, which Bobby had mentioned, medically assisted treatment for substance use, opioid use. What we do is we go out with the street outreach teams, start engaging folks, start building the relationship, because one of our missions is to build long-term relationships, right, and not just episodic care. And so what we do is we start with Suboxone, and then build that trust, build that relationship, and bring them back into the health center to be able to engage in care. And hopefully, through that strong relationship, addressing things like hypertension, depression, anxiety, and cardiovascular disease.
Thank you. Since you all bring a little bit of a different perspective to this conversation, I'm going to jump in and ask you some tailored questions meant to elicit your unique perspectives and expertise. So Molly, I'm going to start with you. And this is going to be a question in multiple parts, so bear with me for a moment. How does New York City currently leverage federal funding to address homelessness? What adjustments or enhancements to the allocation of these funds are necessary to improve outcomes? And while you're at it, which federal policies or initiatives could have the greatest impact on reducing the number of people experiencing homelessness in New York City?
We could be here all day. All right. So with respect to the city's direct response to homelessness and looking at the DHS budget and our sheltering response, federal government's actually a pretty small share. Overall, it is, I have my notes, it's about 22% of our sheltering budget. All of that, virtually all of that, is on the families with children side, where we are able to claim TANF dollars for those who are TANF eligible. But New York City is a right to shelter city. We are providing shelter for all in need. So the size of our shelter system and the amount that we're spending on it is calibrated not to the resources that are available coming from other places, but to the extent of the demand. So that makes us very, very different from other places and means that the city is directly funding overwhelmingly at this point, almost $4 billion that is the DHS budget. I think if you look a little bit more broadly, though, in what the landscape of resources are that are used to address housing instability, obviously our federal partners play a huge role. The affordable housing programs that we all depend on, whether it's supportive housing or affordable housing more broadly. Virtually all new construction in New York City is happening with low-income housing tax credits, right? That's not that is a tax expenditure for the federal government. Section 8 plays an important role there. The continuum of care dollars are important, but overwhelmingly that's going into renewals. So really what we're seeing is that is sustaining investment that we've already made. the new investment in terms of housing programs, right, is really city capital combined with low-income housing tax credit and sometimes Section 8 vouchers. Again, sort of putting us into, talking about Section 8 vouchers. Section 8 is great. We really depend on it. I've been in this space a long time. We used to talk about how many new Section 8 vouchers would be appropriated every fall. That hasn't happened in a very long time outside of VASH. VASH is important, but outside of VASH, there hasn't been incremental Section 8 vouchers. We run the largest municipally funded rental subsidy program in the country, far and away the largest. The City FEPS program, there's about more than 40,000 households that are receiving City FEPS. So we are very grateful for the partnership for the city from the federal government, and particularly on the affordable housing side with respect to the private activity bonds and the low-income housing tax credits, but really the city has stepped up given the enormity of our issues. I'm trying to make sure I hit all the questions. There's lots of ways that we could change things to be more effective. I'm sort of not going to focus on the "we would like more, please," because even though we would like more, please, I think it's not terribly likely to happen in the near term. But I think there's lots of ways that different funding streams could be made to work better together. Right now, most people who are looking for affordable housing are also receiving some other kind of benefit, but all of those operate in silos, right? So the fact that you have had income screening for SNAP, for Medicaid, for something else doesn't matter for tax credit or for Section 8 purposes, right? So we're all doing the same work and collecting the same information over and over again. And then there's lots of, in those limited funding streams that do exist, there's a lot of rules that make them really hard to use. Home dollars, which are available as a capital source, they're great, they're valuable. I certainly wouldn't want to operate without them, but they're also really challenging just because there's been a lot of really well-intentioned but additional requirements that have been put on them. Emergency Solutions Grant, another one that we are thrilled to have, but the fact that there's very prescriptive uses for that funding, and the level of documentation that we need to collect on clients to be able to then claim on it is onerous on both us and on the individuals receiving the services. So I do think that there's, even without adding more, though I would never say no to more, there are ways that we can make the different funding streams work better, both for those of us in government who are using them, but also for the people who are the ultimate beneficiaries, who are the ones who, at the end of the day, bear the burden of immense amounts of reporting. I don't know if I got all of your questions, but we'll let somebody else get a word in edgewise.
Thank you, Molly. Helpful perspective. Tiara, let's go to you. We know that in New York City, the city works closely with nonprofit organizations on issues around homelessness. How does federal funding flow through the city to support these organizations? And how can the city and federal government work together to ensure that these groups have the flexibility and resources to meet the diverse needs of homeless individuals?
Thanks, Judy. So we've mentioned here, and Bobby mentioned on the first panel, the continuum of care. So the continuum of care is a federal initiative through HUD that requires counties to identify a collaborative applicant in the community that will help to organize and coordinate the nonprofits that are applying for federal funds to support permanent supportive housing, transitional housing, recovery housing, and other programs throughout the homeless service continuum. What happens there is that there's an annual evaluation, and part of the challenge, I think, is that the nonprofits are competing against each other for these federal funds, and our ideal is to get as high as the score as we can, and then the COC is then competing nationally with other continuums to make sure that we're getting the funds. And so, like Commissioner Park just mentioned, the COC brings in about $200 million annually that supports 170 programs in New York City, all going to nonprofits. New York is very unique, and just like Commissioner Park just mentioned, in that New York has such a robust system that supports the homeless service system that the COC funds are usually used to supplement other contracting funds, right, through DSS, DOHMH, HASA, et cetera, et cetera. Some of the challenges that we find working with the continuum is that the COC contracts, HUD has very strict requirements, is responsible for our prioritization of chronically homeless households and individuals, which is a great thing, but sometimes is a little bit misaligned with what we are seeing with the need in the community, but is also responsible for our coordinated entry system, which I mentioned before, the CAP system. But what the COC does historically is looking at their evaluation in an attempt to maximize their federal funds, so making sure that they're getting the highest score possible to make us competitive with other continuums throughout the nation. So they're making sure that nonprofits are, I'm going to talk about two key performance metrics here, but one is the chronicity, so making sure that folks are prioritizing chronically homeless households and individuals, which is a great thing. And also looking at, their occupancy, so making sure that we have a high occupancy rate. There's a lot of other performance metrics that go into the evaluation, but those are the two I'm going to focus on right now. So our COC, you get $1 of federal funding and you have to abide by all of their really strict requirements, but then we have all of these other contracting agencies that are involved that have their own requirements, and sometimes those two things are misaligned. So really what we need to make sure is that the city is recognizing that the COC is supplementing these funds and making sure that when we're doing our evaluation, we're taking that into account. And I know that that's one of the things that we're doing. I'll give a short example. Working with some nonprofit providers who have COC funds, again, supplementing some other resources, and a contracting agency like HASA sorry, I'm getting a little flustered. So let me pause. I'm going to give you a real world example here. A real world example of how the continuum and New York City can work together to make sure that we're all working towards the same goal. So, like I mentioned, COC is used to supplement some other contracting agencies and contracts through the city. And COC is looking at their program requirements and doing their own evaluation. The city is looking at their contract requirements, doing their own evaluation. Sometimes those two things are misaligned. So for example, the continuum from on high says that you are required to serve individuals who are chronically homeless. Some city agencies like HASA do not have a chronicity eligibility criteria. And so HASA is saying, we are going to refer anyone who's eligible to these units that you have contracted with us. But the nonprofit is saying, well, because I have the COC contract, I can only take individuals who are chronically homeless. That means, one, that the nonprofit is sort of sitting in the middle, and they are getting points deducted from their COC evaluation. They are getting points deducted from their HASA contract. No one's doing anything wrong. They're all just sort of working within their restrictions and requirements that they are aware of. And so one of the things that we did was to coordinate with HASA, get the COC in the room, get a representative from HUD in the room, and get some providers in the room to talk through how this is challenging. You're getting points deducted, you're in fear of losing your contracts on either side of the ball. And we were told through the HUD representative that while chronicity is a priority, it's not the only eligibility criteria. And I will say that this collaboration is really important because for years, providers were really having challenges scoring well on their COC evaluation and also communicating with HASA about the need to have what they deemed eligible referrals coming in. And there were high vacancy rates, and folks who needed supportive housing wasn't able to access because everyone was sort of working within their contract requirements. And so what we found through just simple conversations with HUD was that we were able to develop a letter that could go into a client file when they were making a referral that would designate or that would document that there were no chronically homeless eligible households that were identified, and that they can move on to the next eligible person. And so I think that level of coordination and communication and transparency is really important, and that the COC, although a small part of the pie, has huge ramifications for us, and the city recognizing that we're using this to supplement and that that's taken into account when we're doing our overall evaluation and making sure that our coordinated entry and referral system is working efficiently.
Thank you. Tori, let's talk about rapid rehousing. From your perspective, how has federal funding supported or hindered the expansion of rapid rehousing initiatives in the city? And are there any federal or local policy changes that could improve the city's ability to adopt or expand this approach?
Yeah, so like I mentioned, Jericho has essentially 3 rapid rehousing programs, and they're all federally funded, and they tend to be very generous with what's called temporary financial assistance. So the idea of rapid rehousing, I'm sure most of you know, is that you take somebody who's literally homeless and you know, with these federal funds that you have, it means you can pay the security deposit, you can pay a broker's fee, and you can pay their rent for really, depending on the program, it could be for up to 2 years. And over time, the idea is that the tenant will get a job, they'll get the benefits that they need, and then they'll be able to take over the apartment after 2 years or however, which is completely unrealistic in New York City because we're renting 2 bedrooms for $3,000 a month. We're using this federal money, which is very generous. Oftentimes the landlords are asking us for double security deposit. Some of the programs allow a $1,000 landlord incentive grant. And I think that, you know, the people that we house is great and they can get into housing rapidly. That's the whole point. And then we provide services with them. We provide employment support. But if you need to be making $100,000 to pay for your 2-bedroom, that's not that realistic when I think the median income in New York City is like $60,000, $60,000 or $70,000. Not that we don't try to get those kind of jobs. And then I think what's happening at the same time is inadvertently, I think we're driving up rents and expectations. You know, we have laws in New York City, at least I thought we did, where you couldn't ask for a double security deposit, but we pay them all the time because what my colleagues tell me is that, well, they won't rent to us, you know, because it's a homeless person, you know, it's, you know, like what we were talking about before. So I think there's, it's very effective getting people, and I was just telling somebody earlier today in our unsheltered program that we just started in January, our average time to place somebody is 12.4 days. I mean, that's incredible to go from homelessness to your own home with the rent paid, you know, in less than 2 weeks. It's really incredible, and it's obviously very life-changing, but I just worry sometimes about the consequences. And so I know this is a little like off the question you asked, but I think the federal government really, we have such a big affordability crisis that without the help of rapid rehousing, us paying their rent, they would have no chance. And luckily, thanks to New York City, we're able to get a lot of them a voucher so that when we stop paying the rent, they have a subsidy. So it is affordable. But there's only so much New York City can do as well. So we need to build more housing. I think, Molly, you touched on it, that the home funds are very difficult to use. The federal dollars to build new affordable housing is very complicated because of the prevailing wage rules, which aren't necessarily cumbersome because of the wages. It's because of the monitoring and the paperwork and you know, everything that you have to do. So developers are choosing not to take federal money because their price goes up by 30 or 40%, is what I'm told. So, you know, I think it needs to be part of a broader thing, but the rapid rehousing is key, and it's very low threshold, you know, but you have to have enough apartments available. And that with a 1.4% vacancy rate in New York City right now, that's not very likely.
Thank you, Tori. Jonathan, a question for you in a couple of different parts. So we know that people experiencing homelessness face complex health challenges. How does federal funding for health services align with the city's efforts to provide supportive services to individuals experiencing homelessness? And are there areas where this support could be improved? While you're at it, what role does Medicaid play in delivering these services, and how can we better integrate Medicaid funding with local supportive services?
Thank you. So as mentioned before, we are in a Medicaid expansion state, which provides a little bit more access for folks to get Medicaid, as well as a little flexibility for the reimbursement compared to non-expansion states. We still need more flexibility, although Commissioner Park won't say it. I would love more money. And so, you know, there's a really big part of that because of the efforts in the communities that we're working with. Really, we're not able to keep up with the costs that it takes to engage our communities, right? And so, and that Medicaid rate, while generous, does not quite get there, right? And so, so that's sort of one of the pieces. The other piece is because the state is an intermediary, the 50% of the Medicaid, as mentioned before, 50% federal, 50% state, you're adding federal regulations, city regulations, and state regulations on top. And as Sierra mentioned, they don't always match up, right? And so you're fighting against conflicting regulations in order to be able to provide services. And so we need to get creative and collaborative and all those levels, right? To be able to, instead of adding on, but sort of integrating some of those regulatory restrictions to allow us to provide the supportive services that we know that our communities need.
Thank you. And Rob, effective data collection is crucial for understanding the scope of homelessness. How might federal policy change if we had access to different data sets? How do you see data influencing policy decisions, and which policy issues would you focus on to drive change?
Sure. Let me start out by saying we do need more, right? I'm going to disagree with Commissioner Park. We need more housing choice vouchers. Let's be real. In this city, there's a large section of society that's going to need rental subsidies, period, right? City does a great job coming up with city FEPs, but we need some federal government intervention. Send the housing choice vouchers our way. We could definitely use them. I want to respond to Jody's question by piggybacking off of a lot of the stuff that Tiara said. So as you heard, I spent 12 years in the continuum of care. And people who work in the continuum of care give a huge time commitment and knowledge commitment. And some of us absorb knowledge and we want to make that system better because it is a competition. I gave 12 years. I didn't get a dime for it. It's not about the money. You want to see change around these particular issues. And something that I'm very proud of, before I went homeless, I came from IT. I worked for automatic data processing, the payroll company. So I care a lot about data. When you go into communities, people see data as surveillance. I didn't see it that way. When the Hearth Act came about, which was an addendum to McKinney-Vento funding in 2008, the federal government says, we need you to start collecting data if you're a McKinney-Vento funded program. I was one of the founders of the Data Management Committee in New York City and believed in collecting this data and somehow trying to figure out how we send a better picture to the federal government. I don't want to criticize care providers. Care providers and not-for-profit organizations do a great job in the city, but there are many providers that are large programs, might have 20 programs in their portfolio. 2 are McKinney-Vento funded programs, 18 are non-McKinney-Vento funded programs. So the argument within the continuum of care was, HUD is trying to put these restrictions on us to put data into this portal, but why are they telling us what to do? They only fund 2 of my programs. Well, I think that's where we're missing out, right? Those 18 that aren't going into that data portal, the federal government doesn't get a complete picture in New York City, right? So we're taking a misstep. And when our mayor constantly says that he's not getting help from the federal government, well, we need to do a better job. Care providers might have an argument, but we have several systems within the city and the different programs that is collecting data. Make those programs talk to one another. It's not that hard, folks. That's what we used to do back in my day at ADP. We made system 1 talk to system 2. Collected data in one central place and make it useful to make the change that you want to see. So I think it's important for us to find a way, and maybe the onus is on the city and Commissioner Park, right? I'm calling her out up here, right? To make our CARES program feed into HMIS, to make the DOHMH programs feed into HMIS. then the federal government's gonna have a better picture of what is happening in New York City. And I think then that makes the job easier for the US Interagency Council on Homelessness to go back to the Hill and say, New York needs more support because they're doing this. Look at all of this data, right? So it doesn't seem complicated to me. I think what it is political will and people thinking outside of the box and stop pushing back. The federal government's not gonna continue to give you money without putting some rules on that money, right? So they're gonna give you a check every year for renewal, but they're gonna put some demands on you, and that's life. So we have to deal with it.
So one of the overarching takeaways for me from the first panel was this feeling of optimism and empowerment around the power that exists at the local level to push back when you disagree with federal policy. So in the context of the external environment in which we are now operating, with the incoming changes at the federal level and at the presidential level, what are each of you thinking about as it relates to things that you're monitoring and how you're preparing for the next 4 years as it relates to ensuring that people who are experiencing homelessness get their needs met and continue to be a priority? Whomever feels moved to speak.
Sure, I don't know that I'm bringing a lot of optimism to the table here, but I think we are particularly focused on what is going to happen with safety net programs, right? That is, while, as I said earlier, not immediately related to homelessness, if you take people who are extremely low income and economically vulnerable and make them more so, that is certainly not going to help the people's search for housing stability. So SNAP, for example, is up for reauthorization essentially immediately. And this is a place where we want to have a really big tent, right? There's a robust group of food advocates in New York City, right, who have done a really great job of talking about SNAP reauthorization. But, people who care about housing stability should care about SNAP too. And then I think there's a lot of particularly vulnerable populations that we are going to be, that I worry about all the time. I think, the difference between the first Trump administration and the next one for New York City is, right, that we have obviously a huge number of recent immigrants in our care. And I think that is a population that we're spending a lot of time thinking about how we protect. But it goes broader than that. In the first Trump administration, there was an attempt to block trans people from accessing shelter, right? And so we need to make sure that any individual in New York City who needs access to care has access to the appropriate care. And that's something that I personally believe in very strongly and that we're going to be really fighting for. I don't know if you want to talk about things that we affirmatively are doing at the local level and where I think there's opportunity, or if that's a separate question.
We would never, try to compromise your creative spirit.
All right. Well, in the spirit of being a little bit positive, I think there is a lot of things that we are doing at the city level that is really positive and encouraging. Right, the city invests an enormous amount in affordable housing. Right, so while tax credits from the federal level are really, really critical, and we would be lost without them, the fact that the city spends $1 billion a year in capital funds on affordable housing is also incredibly important. I think City of Yes, the zoning proposal that is in front of the City Council, I believe tomorrow, is incredibly important. It is not going to solve housing stability for the lowest income New Yorkers, but if the market can do a better job taking care of people who are moderate and middle income, then that frees up government to worry about the people who are most in need. And a program that I'm really excited about to be just entirely self-serving is the DSS Affordable Housing Services Program, where we have taken our city FEPS vouchers and project-based them into a 30-year contract. So it includes the rent, it includes the some maintenance and operation funding and some light touch social services. Not-for-profits who are getting that are able to use those contracts, leverage private debt, and acquire buildings. We closed on financing on those for 4 of them over the summer. 1 of them needed a little bit of construction. The other 3 are fully leased up, which for those of you who know the affordable housing landscape, to go from closing to lease up in a space of about 6 weeks is virtually unheard of. So that's something we're really excited about.
I just wanted to piggyback on the diversity of the communities we serve and paying attention to that. I think is something that we, from a healthcare lens, are paying attention to, both with our gender expansive community members, TGNB, and migrants, but also how the isms and the policies of these isms affect our health, right? And needing to sort of keep that healthcare lens attached to how folks are coming in with more chronic disease, and being able to respond to that, not only supporting our staff who are experiencing trauma, but being able to deliver proper trauma-informed care.
Oh, I'm gonna take a shot here from about 50,000 feet up. Tonight, after I teach a class at the new school, I go out to JFK to get on a plane to go to Brazil. I was invited by the International Legal Foundation to talk about criminalization, poverty, and status. And I think with the new incoming administration, I think we're in for a fight. And I don't mind a good fight. That's probably why I walk with the cane today. I played football and wouldn't give up. Broke my hip every year of high school. Went my freshman year to Maryland and broke my hip and pelvis. And, that was it for football. But I won't quit. I'm not a quitter. I think people's basic needs need to be met. And that looks at this work through a human rights framework. I think housing is a priority, food, water, and healthcare. And there are people not only in the city, but in this country that go without those things. So it's incumbent upon myself, people in the International Legal Foundation and others, to really talk about putting together a strategy for the next 4 years. It's going to be a challenge. I'm not disillusioned, right? I've seen, I do a lot of work at the UN. I work with an organization called Partners for Dignity and Rights, where I'm a senior advisor here in New York City. And I think that the incoming administration is going to do everything they can to make the UN disappear. So it is incumbent upon all of us, if we believe in human rights, to stand up and say people have a right to housing, people have a right to food, people have a right to water, and people have a right to health care. Right? It's only going to change when we all rise up, when we get rid of NIMBYism and say, this person isn't deserving, everybody's deserving. Just as Jeff said on the first panel, because of the fact that you're human, you deserve certain things in this world, and that's a constant fight.
I'm worried about almost every department. I agree that the safety nets are very vulnerable right now, and the rhetoric that's in this country now is blaming poor people for the state of our country, which is just unbelievably misguided. I think that, together with the fact that the goal is to completely disrupt the I don't like using that word, but disrupt the federal government, and that, together with misinformation, is a dangerous combination. For example, and I might not have this right, I think it was Arkansas or Kansas where they tried to put work requirements on public benefits, and it was a complete disaster. They had so many people go off the healthcare rolls, and so that seems like a win, right? But then folks still need healthcare, so they're going to the emergency room or whatever. So I'm afraid that there's there's so much misinformation, and so I think this is where we need to fight back. You talked about data. We need to have our data, and it needs to be reliable data. We need to be able to defend it up and down the line. And so I don't have a crystal ball, but I think everything is on the table because the reality is they're going to pass large tax cuts, and they have to figure out a way to pay for it because they don't want to increase the deficit. And they're going to do that by cutting Social Security, Medicaid, Medicare, any kind of public benefit that they see doesn't help their friends and powerful people. So that's a little cynical. Yeah, but it's so my one gleaning hope is that there are so many good government people in government, in the federal government, and you can't get rid of them all. So so we need to work at those lower levels, maybe a little disruption of our own against the leadership. Go ahead.
Just a quick response to what you said about the good people in government. We saw this movie before, right? Being involved in human rights work, I work with some great people at the Department of State and different levels of federal government, that went to Geneva with us, right, to argue points. But once Trump won in 2016, I used to ask the question, are they hiding under desks? They disappeared. So, I think that's something we have to think about, right? How do we keep engaged with those folks? Where are they? They will need our support also, right? Well, if they're going to fight on the inside for us. So something for us to think about.
Yeah, what everyone just said. But I think that we've been fighting for marginalized people no matter who's in charge of the federal government for a very long time. We've been fighting for universal rental assistance. We've been fighting for more money from McKinney-Vento. We've been fighting for more money for stat benefits. Sometimes the fight is a little bit harder. Sometimes you're preaching to the choir and just trying to get a little, a little 5 cents, 10 cents, 15 cents where you can. But the fight doesn't stop. We've been doing this for a long time, and those of you who have been in this work for a lot longer than I have know that to be true. But aside from that, I think what we need to do as the city is make sure that our systems are in place, that our systems are working efficiently, that our nonprofits are solvent, and that they have the resources they need through their city contracts to be able to provide the services without reliance on the federal government. How are we creating more bureaucratic systems that make it difficult for them to get their funding? We've, as a membership organization, I'd be remiss if I didn't mention this, but a lot of our nonprofits are struggling because of late payments at the city level. So we need to get our house in order first and make sure that we are doing every single thing that we can at the city level, reducing all of as many administrative burdens as we can to make sure that our nonprofits, without reliance on the federal government, without thinking about those restrictions, are able to provide the services that New Yorkers need.
Checking with my colleagues in the front row, should I continue or are we moving into Q&A?
You can do one.
Oh, okay. I think I just want to give anyone who wants to take it an opportunity to put out ideas of other things we can be doing across the local and federal government levels to help deliver for people in New York City who are experiencing homelessness. A lot of you shared best practices and ideas, but to the extent that there's something that you haven't shared, an idea, a thought, now is your opportunity.
So I'm a big believer in the housing first model. I'm looking to go to Finland this coming summer to study their model. Helsinki, Finland has incorporated housing first since 2008. Homelessness is no longer a problem in Helsinki, Finland. I think there are also cities in this country that are doing a good job. And as somebody said on the first panel, how do we scale up, right? Dallas, Houston, Hennepin County, there's a county in, I believe in Wisconsin, I won't say the county because I could be wrong with the county, but doing good work, right? By really pressing forward with this housing first model. While I believe in the providers here in the city, I think there are a lot of arguments that are internal. I don't believe in the housing first model. A good friend of mine is sitting in the audience, Erica, says, we spent a lot of time in this country when you look at homelessness, trying to rebuild people rather than looking at the system that is broken, right? So we have to think outside of the box. And, I think the start for me is housing first policy, mandated across anybody that is receiving any type of service or any type of funding from federal government, local government, et cetera.
I think that we have to identify and have conversations about the different levels of care needed in our system. It's not a one size fit all. For instance, we're co-located and we have federally qualified health centers co-located in both our owned and operated and our partners' buildings and establishments and shelters, drop-in centers, et cetera. And we're restricted to staying in the health center to provide those services. We can't go on beyond those four walls. One, we don't get reimbursed, and two, our federal malpractice is not applicable outside of the walls, right? And so again, literally thinking outside of the box of our health center that are in these co-located areas, so that we can provide different levels of care on the other side of that wall, I think is going to be really important moving forward.
And the state has a very significant Medicaid waiver right now that will allow Medicaid dollars to be used for to address a variety of social determinants of health. This has been a process. What does that actually mean? What does it look like? How is it going to actually translate to services on the ground? And I don't have the answers to that yet. And unfortunately, given the time that it has taken to roll that out and the end of the waiver, I think we're going to have a relatively short runway, but I also think it has the potential to be really exciting because it does address the fact that and does put real dollars to the fact that health is dependent on people's access to food, access to housing, all of the things that you mentioned, right? And so if we can get this to work, and if we all are working together, I think it does have real potential. I think talking about data, that's a whole other, conference, but there's 3 designated social care networks in New York. They're all using 3 different databases. So, it's going to be a challenge, but it also has real potential.
I think maybe one idea that is, a bipartisan, which was mentioned before, is the opioid crisis. And that is a health crisis, but we can also link it with housing. And I know I had breakfast with a colleague from the National Equity Fund about a month ago, and they're piloting, I think it was in Illinois, they're piloting housing programs for opioid users specifically. And so that might be somewhere where we can address a very bipartisan issue, because it doesn't matter if you're Republican or Democrat or independent, if everybody is affected by the opioid crisis. And so that can be something that might be, a glimmer of hope, is to, yes, get more beds and get more treatment and more prevention and more medical treatment, but also let's, think about how we can, obviously your risks as an opioid user go way up if you're homeless, and they go down if you have a home. So that might be one idea that might be popular or palatable.
West Virginia is a place to look at that.
Yeah,
They're doing some good work now.
Okay.
Well, the only thing that I would add is that we can't only care for people when they become homeless. We have to start very early on.
Yes.
I know that we're talking about homeless policy, and I know Jeff earlier talked about music's prevention framework, but early childhood education, disrupting the school to prison pipeline, making sure that folks have economic stability early on to really, really prevent the possibility of becoming homeless later on. And then universal rental assistance is something that we've been talking about, something I will bang the drum about forever, for as long as I can live. I'm a product of a housing choice voucher that allowed me to get my bachelor's degree and get stability and go on and get my master's degree from an Ivy League institution. So I know the benefits. I can talk to the benefits of that program, and I will beat that drum forever. But really, from just an emotional and human standpoint, we have to start we have to start a lot earlier. And I know a lot of you are out here doing really good work for the clients and tenants that are in your supportive housing residences and otherwise. And some of those are families with children, and disrupting that cycle of homelessness and generational poverty is truly, truly transformational. So just starting from there.
Thank you for these insights, and now we're going to turn it over to some questions from the audience.
Great, thank you. Thank you again for submitting. We have a lot of good questions. So the first one is, how can the homeless response system better work with NYCHA to create more subsidized and affordable housing opportunities to New Yorkers?
So NYCHA is absolutely an important partner for us. They actually have opened up their Section 8 waitlist and are issuing vouchers for the first time in many, many years, and an allocation of those vouchers are going to individuals in the DHS system. With respect to public housing, we absolutely do coordinate with NYCHA so that people can move from shelter to permanent housing in NYCHA developments. That number is lower than it has been in the past because NYCHA is actually doing some really innovative work to address their own very serious physical conditions, right? So they have large-scale major rehab projects going on and are using vacancies to checkerboard and move people around while that rehab is happening. That is short-term challenging for us, but in the long term, right, if we lose NYCHA housing, like, forget it. It's, that is incredibly valuable housing for the city of New York, and we, as people who care about affordable housing and homelessness, should want NYCHA to absolutely to thrive. So while right now it is the flow of units is a little bit more challenging than it has been in the past, I actually am incredibly supportive of all the work that NYCHA is doing. I will say that the number of units that we are receiving specifically for DHS clients from HPD, from that Department of Housing Preservation and Development, has skyrocketed. So, we've blown through records every year for the last several years in the number of units that we're getting there. So, housing supply is something that wakes me up at night. I think Tori mentioned the 1.4, I'm not a very good sleeper, but the 1.4% vacancy rate, like, absolutely we have real supply constraints, and NYCHA is a part of that, but I'm also thrilled about the work they're doing to maintain their own stock.
So I think this is a role a federal government can play, right? Because while NYCHA was always thought of as a true social safety net, they're sitting in a place that's weird right now. About 17% of those apartments are vacant and in a state of disrepair, right? So we need federal dollars to bring those apartments back online. We know public housing works. Public housing has fallen around the rest of the country, hasn't fallen in New York, right? Because we have 500,000 people living in public housing. So if they were all put out, where's that city gonna go? Because it is another city, right? So we have to reinvest, right? We need capital dollars to bring these apartments online. So that's, again, we have our partners, USICH, that can go to the Hill and say, you can change conditions in New York if, right? Uphill battle, especially with the incoming administration. But these are part of the conversations that need to happen.
Thank you. What have you found to be effective strategies to provide care for people with substance use and mental health challenges?
In addition to the MAT program that I mentioned before, getting folks on Suboxone, having them feel better physically so that they can engage in a conversation and hopefully gain more care. We're in the process of expanding our behavioral health program to be able to be there at any point in anyone's mental health journey, right? And I think that that's really important. We very often, very similar to what you were saying about homelessness, respond to when someone's homeless, right? And so very often we're responding to when someone's in a mental health crisis, right? But if we can get them earlier into care, we can sort of hopefully prevent that crisis, right? And so it's really about not only going out and into the community and building trust in the community, right? Because trust is built, and then being able to sort of build on that to provide comprehensive care and integrated care, but it's also getting folks early before a problem is identified.
Most of the supportive units that we have at Jericho Project are set aside for individuals who have a diagnosed substance use disorder. And so, I know a lot of you here in the audience are providers, but the tools that really work that we use at Jericho, and I know a lot of you do as well. First of all, housing first is the first step, that you're not requiring people to have sobriety or be on medication. We've been doing that for a long time. We know it works. The second is to use some evidence-based models that I'm sure everybody's familiar with, like harm reduction and motivational interviewing. Whereas, care used to be like, you need to stop doing this. You're hurting yourself, you're hurting your family.
Fixing people.
Yeah, and so, you have to, I know that's the old saying is you work with people where they're at, and that's what's been really effective at Jericho, and I think really around the country. So, the system needs to be fixed, and we need to support people because they're the experts in their own lives, and we can't tell them what to do, so.
If it's okay, moderators, here. I wanted to just share very briefly a perspective on this. And it's a little bit about why I come at whatever's happening in our external landscape from a place of optimism. We still get to control how we show up and how we support the people we serve and walk alongside them in their journeys. And at ICL, we do a lot of work with people who are struggling with mental health and substance use disorders across a lot of different programs that have a lot of different approaches. But I think the single most common theme when we're successful in our success is really seeing the relationships that we cultivate with the people we serve as part of the treatment, being there for people who've been failed over years and decades by so many systems, continuing to show up and engage in the relationship. And that's something we can do no matter who's president.
Can you share what services are offered during transition from street to housing, and how critical support is during that period of transition?
Sure, I'll start, but colleagues should chime in. So at the Department of Homeless Services, we do 24/7 street outreach. So some of that is city employees, more of it is working with not-for-profit providers. That is really about the same kind of trust-building model that we've talked about in other contexts, right? Particularly in a right-to-shelter city, people who are experiencing unsheltered homelessness have been failed by everybody, right? By family, by religious institutions, by government, by multiple levels of government, right? I mean, you name it. So there is a lot of engagement trying to, convince people that coming inside is in fact a reasonable option. We have a variety of different models that we offer for those experiencing unsheltered homelessness. We have what we call our safe haven and stabilization beds. These are programs that are specifically for those experiencing unsheltered homelessness. They tend to be a little bit smaller and less dense than a traditional shelter, and they are accessed not through common intake, but through a referral from one of our outreach teams. It is a continuum, so I can't say a safe haven is never more than X beds and a shelter is always at least X beds, right? But they are generally, as I say, smaller, less dense, slightly fewer rules. But many people also go from the streets to the more traditional shelter system. It depends on what an individual's needs are and honestly what vacancies we have at any given point in time. A couple of things that we have done recently that I think are important in serving those experiencing unsheltered homelessness. We've added what we call our welcome center model. We have one in the Bronx, one in Brooklyn, with the idea being that these are very low density settings that people can come to in the moment, right? So they connect with an outreach team, and if it's 2 o'clock in the morning and they're on the subway platform and they haven't eaten and they haven't slept, right? That is not a good time necessarily to be talking about what your ongoing placement is going to be. Let's get you into a bed. Right now we're using hotel rooms, although we're looking to make them more long term, right? Let's let you sleep and shower and eat, and then we can sit down together and figure out what the next step is, right? But that no decision made in that moment of crisis is necessarily going to be the right one. So I think that is an important model that we've added. And then the other piece that has been, I think, immensely innovative, even though very basic, is that we brought our streets, the team at DHS that handles unsheltered homelessness, we brought them into the housing conversation. And it used to be that our metric was, has somebody come indoors? And then, we sort of check at that point. But shelter's not the goal for anybody, right? Our goal for absolutely everybody is permanent housing. So we now have, when we have our weekly meetings on how are we doing on our permanent housing placements, it's the families team and the singles team and the streets team. And we're actually seeing, really tremendous growth in the numbers of people who are moving from, sometimes directly from the streets, sometimes from one of the safe haven or stabilization beds into permanent housing. It can be supportive housing, or it can be just general market housing with a city FEPS voucher. It depends on what people need and what they want, but really record-breaking numbers there.
You have spoken about the government-funded responses to the homelessness crisis, but faith-based organizations and community organizations often stand the gap. What coordination or funding is going to support these programs that often care for those who do not or will not stay in city shelters?
Yes, that's another one. Another one for me. Sorry. So, good question. And now I'm going to have to talk like a bureaucrat, right? I'm administering government money, and everything I do has to follow rules. And when we getting money out into communities, getting people paid, making sure that we have a diversity of providers is incredibly important. But if I don't follow all the rules, then I, end up in the newspaper for other kinds of reasons, right? And we've all been there, right? So there is, we have an open-ended RFP, right? We want people to come to us. We want to work with a diversity of providers. I think one of the upsides of the fact that our system has had to grow so rapidly over the last couple of years is that we are now working with a range of providers that we haven't worked with in the past. That's a positive, but I can't be in a position of saying, yes, faith-based organization, you are doing good, good community-based work, and therefore I'm going to fund you. We have to follow the procurement rules. So I realize that is a frustrating bureaucratic answer, but it's the truth.
We receive city council discretionary funding for collaboration with faith-based organizations, and have a couple of faith-based organizations in which we are co-located. So going out to them, we have, across the city, we have such a strong network of resources, and faith-based is very much a part of that. And we are open to those partnerships, and continue to do the work that way.
What are the benefits of the data collected from HMIS and other systems?
Gives you the perfect picture. What's happening, right? And I think one of the key takeaways for me when HMIS was first instituted was high rates of recidivism, right? Who was going in and out. And that allowed us to run interventions at certain stages to try to prevent those high rates of recidivism. But I just think data overall, depending on what you pick, it tells you who are these people, how long, who's chronic, it answers a lot of questions that you might have, right? So it's so important, but it also sort of frames the issue in a particular city. And for us, again, as I harped on earlier, if we had these other databases feeding into HMIS, I think the federal government would have a better picture of what was truly happening in New York City.
This isn't an HMIS answer exactly, but a data piece that I think is really informative. We talk a lot about eviction, right? And there have been a lot of efforts to say, let's reduce homelessness by targeting people who are facing eviction. Well, in New York City, about 10% of the families with children entering the shelter system do so after a formal eviction. It's actually lower right now, but that's skewed by the numbers of recent immigrants. And in fact, something like 75% of the families with children who enter haven't had a lease at all in the last 2 years. 2 years is the number the time frame that I have, because that's what we look at, right? But overwhelmingly, the people entering the shelter system are, on the families with children side, are either domestic violence survivors or very young families who had been living, with other people before they entered the shelter system. So without the data to know who's coming in, we don't know where to target that intervention, right? So if we put a lot of, not to say that eviction isn't a problem and that the housing stability issues associated with eviction aren't a challenge, but if we say we are going to reduce homelessness by targeting people facing formal eviction, we're never going to be successful.
So I agree with Molly, and I think I don't know how many of you know, New York City has something called an open data portal. It contains a lot of information. It might look like a bunch of puzzle pieces to some, but I'd make the argument that's how we got Right to Counsel passed, because folks went into that open data portal, separated those puzzle pieces to pull out information just as Molly is talking about, and that gave people who work in the tech industry an opportunity to work with people who really are focused on getting people housed, working with legal services. Data is key, folks. It's just, I'm going to keep harping on it, but data is so key.
And I just want to add something from the COC lens. I know, Commissioner Park mentioned earlier that the majority of the COC funds are renewals for programs that are already operating. However, there are some opportunities for new projects to come into the continuum, but that is all really data-driven. So,
That's right.
For instance, HUD has issued the Youth Homelessness Demonstration Project, which allows municipalities and COCs to apply for funding that goes to support youth aid and foster care and other homeless youth. And the city, it was a highly competitive program, but through a needs assessment and data analysis, the city was actually able to get that grant awarded. Clap, clap, clap for and then also through the DV pilots, right? So there are some other opportunities through the COC to get money that comes in to support survivors of domestic violence and their families. And that is all also really data-driven, although it's not through the HMIS system, but it's based on a needs assessment. So I think that data helps us, when all else fails, to actually bring in some additional funds into the continuum and into the city.
But Tiara, I think also with data, it taught us a lesson in the COC. We used to send money back to HUD.
Yeah.
Now we recapture that money and we figure out what else we can do with this money, right? Into those new programs. Yeah. But again, all data driven.
And your renewal is based on data through the HMIS portal as well. So it really does matter. And for those who are not familiar, the HMIS is the Homeless Management Information System, which is the system that we use to transfer data to HUD.
All right, that is our time for Q&A. There were several more, but that's what we have for today. Thank you very much.
Thank you to our esteemed group of panelists. And if everyone could stay put just for another moment, Natalie is making her way up to help wrap us up this afternoon. Thank you again.